Hello, I'm here today to talk about myasthenia gravis. So let me get my screen share. Myasthenia gravis, and the meds we use for it are anti-myasthenic meds. So what is the pathophys of myasthenia gravis? Myasthenia gravis, it's an autoantibody that attacks the acetylcholine receptors in the muscle and plate membranes. In other words, it attacks its own self, the muscles, and this results in nerve impulses not being transmitted to the skeletal muscle at the neuromuscular junction. So symptoms would be weakness and fatigue, definitely difficulty chewing and swallowing, dysphagia, ptosis, which is the eyelid drooping, diplopia, double vision, weak, hoarse voice, difficulty breathing, diminished breath sounds, and respiratory paralysis and failure, which is the most life-threatening, of course. Treatment is we monitor the respiratory status because it's priority for the ability to cough and deep breathe, and for respiratory failure, and for the need for suctioning. Monitor the ability to speak and chew and swallow. Encourage them to set up for this, no laying down. Monitor vital signs. Do client education on how to conserve energy, doing short activities that coincide with times of maximal muscle strength. So when I have rested and I'm feeling good is when I do these little bursts of energy. Instruct them to conserve their energy and avoid stress, which will exacerbate it, infection, fatigue, and any over-the-counter meds. All of these will cause problems. More treatment. Assess for muscle status, monitor for myasthenic and cholinergic crisis, administer the anticholinergic meds as prescribed, and instruct the client to wear a medic alert bracelet. Inform the client about services from the Foundation of Myasthenia Gravis. So the meds themselves, anti-myasthenic meds. So they're also called anticholinergic meds. Their action is to obstruct the acetylcholine breakdown at the neuromuscular junction. So they stop the process that myasthenia gravis starts, where that muscle communication can happen. It's used to relieve muscle weakness and to diagnose myasthenia gravis, or to distinguish between cholinergic and myasthenia crisis. On screen, I have listed the two drugs that we use, the neostigmine bromide and the priodostigmine, and then the diagnostic one is also listed there. So nursing interventions. For neuromuscular status, we're checking reflexes, their muscle strength, and we're going to monitor the medication. If they've gotten too much med, they're going to go into a cholinergic crisis. We're going to monitor for an underdose or not enough. That's the myasthenic crisis. They need to take them on time to maintain therapeutic blood level and take with food to prevent GI upset. This is a lifelong therapy. This is not something that they stop when they feel better. So let's go back to this overdose of cholinergic crisis and monitor for underdose myasthenia crisis. So when I've had too much, I want you to think about what they'd look like. And when I've had too little, what would they look like? So if I've not had enough and you gave me more of the med, I would get better for a short period of time. If I've had too much, I would get worse. So that's the way you can tell, okay? So thanks for joining me. I hope this has helped. And if you need to contact me, there's my email, Rhoda Summer at 101NCLEXtutoring.com. Have a good day. Bye-bye.